A lot's happened over the last few weeks. I worked my last day as a CNA in the emergency department, packed up my things, said goodbye to friends and family for a while, and moved to Chicago. Now here I am, ready to start medical school. With all of this change, as I look forward, I also wanted to take time to look back to reflect on the past couple years, particularly in my time spent as a CNA in both the ICU and ER. This time was filled with some incredible experiences and invaluable insights, and today I wanted to share some of what I've learned. Let's go. The first thing here is that everyone plays a vital role. Now, this isn't something that I necessarily learned here, but more so that I reaffirmed. In a dynamic, fast-paced environment like a hospital, everyone is essential, from the cleaning staff to the CEO. Think of them like pillars of support holding up the hospital itself. Without any one of them, that structure is going to be weaker and will only be able to stand for so long before everything comes crashing down. So be appreciative of everyone that you work with and always treat everyone with dignity and respect. Number 2 is a nice segue from number 1, and that is that you are a valuable asset. Don't ever forget it. So as a CNA, it's easy to feel sometimes that you're lower on the totem pole, but as I mentioned in point number 1, every job is crucial and a CNA is no exception to that. As a CNA or tech, you spend a lot of time with your patients. You get to know them, you build those relationships, you might see or hear things that no one else does. When that happens, you need to feel comfortable and confident speaking up because it could save your patient's life. Even recently, before my last day in the ER, I was rounding on my patients, walked by one of their rooms, and just saw this look of death. After working long enough in the ICU and ER, you sort of develop this pattern recognition to know what that looks like to some extent. And this guy did not look good. I checked the monitor and saw that his oxygen was in the 50s. Not good. But it wasn't alarming for some reason, so I quickly alerted the nurse, we addressed it, and he did stabilize. But had I not seen that and brought it to the nurse's attention, he likely would have coded shortly after. And the point of this example is really just to bring home the importance of your job as a CNA. Number 3 is to build relationships. And if you're a CNA, there's a decent chance that you're a nursing student, a pre-med, or are on track to pursue further education and training in medicine. But regardless of whatever track you're on, building relationships within the workplace will be invaluable. This will not only foster good teamwork with your coworkers, but will also facilitate your learning and career progression as well. So in building these relationships, mentors may take you on and teach you. They may invite you to participate in things outside of work, such as research. And if you are pursuing further education and training, you'll need letters of recommendation, which they can provide. I had a mentor in the emergency department who wrote an amazing letter of recommendation for me. Most letters are anywhere between 3/4 to a full page, and this one was 3. A faculty member actually brought it up in one of my med school interviews with how impressed they were with this letter. Not just the length, but the message too, which was powerful. And I did get accepted to that school, which is actually where I'm at now. Obviously, that wasn't the only reason that I got accepted, but I have no doubt that this letter helped. Build relationships. Number 4 is listen to your nurses. This is a big one, and it applies to everyone in the hospital because ultimately we're all there for the patients. And the nurses are the boots on the ground. They're in the trenches. They spend the most time with the patient, know the ins and outs of their chart, and generally have the most up-to-date information. Their input is invaluable, and ignoring it can potentially have devastating consequences. And this applies to all tiers of the healthcare team. So whether you're a CNA helping get the patient up to the bathroom or a physician placing orders, if a nurse brings something to your attention, you need to listen. Number 5 is that the little things matter. Admittedly, as a CNA, our level of education and training is relatively low. As a result, our responsibilities are quite different from that of a nurse or doctor. I was never placing orders or giving meds, but the nature of the job allowed me to zoom in on things that, while not necessarily life or death, made a substantial difference. For example, getting the patient that extra warm blanket, helping them FaceTime with family or friends, or even just spending a few extra minutes with them talking, especially during the pandemic with visitor restrictions. These things may seem insignificant, but sometimes the smallest things can have the greatest impact. Number 6 is that you're also caring for the family. So one thing in medicine that you don't realize until you're in it is that while you're caring for the patient, you're also caring for the family. Whoever calls for updates or comes in to visit, it's kind of like they're also your patients that you didn't know you had. They have fears and concerns that you need to address. Many times they're also the main care providers for the patient. They have valuable details that they can provide for the history, or they may even provide it in its entirety depending on the patient's status. So you should listen to what they have to say. And then after discharge, these family members will often be the ones providing follow-up care, so they need to be well educated on the diagnosis and treatment plan. Family members can help alleviate your stress, or they can add to it. Sometimes this may be out of your control, but it's also highly dependent on how you communicate with them. Number 7 is to have the hard conversations, and this stems nicely from the last point because what's best for the family is not always what's best for the patient. And while you are caring for the family as well, your duty is ultimately to the patient. The best example that I can provide here is with the dying ICU patient undergoing prolonged misery, being kept alive by uncomfortable, invasive medical interventions, and a family that can't let go. In cases like this, it's imperative to have those difficult conversations with the patient, if they're able, and the family members, because sometimes there's simply nothing that we can do, either due to the severity of the illness or the natural aging process. And subjecting the patient to prolonged treatment without reasonable hope for a positive outcome is often painful and downright cruel. Sometimes the best treatment plan is to make the patient as comfortable as possible and to surround them with loved ones. Number 8 is to set boundaries with your coworkers and employer. The demanding nature of healthcare, especially in a hospital setting where we're often understaffed, can easily subject a hardworking go-getter to situations where you're taken advantage of. To help maintain your own health and sanity, you need to establish these boundaries. Realize that you're only one person and you can't possibly cover every shift or fill in every position in the hospital. It's okay to say no sometimes. This point is one that I'm particularly bad at because I always pride myself on being one of the hardest workers in the room, and this is a lesson that I've had to learn the hard way. While you should work hard, you also have to look out for yourself because otherwise the machine will chew you up, spit you out, and move on to the next bright-eyed and bushy-tailed mark. Number 9 is that it's okay to burn out. Healthcare is an incredibly rewarding field, and we're all privileged to be a part of it. But on the other hand, it can also be incredibly stressful, and the high demands placed on healthcare workers can often outstrip our resources to effectively deal with them. And for many, if not all of us, this may lead to burnout over time. I've personally burned out on multiple occasions in the ICU and ER throughout the pandemic. And it feels like there's a stigma associated with burnout, but it's just a natural human occurrence. If you get worked hard enough for long enough, you're going to burn out. But there are a few important things here. The first thing is having the awareness that you're burning out. Second is being able to admit that it's okay. And then third is taking the necessary steps to address it. One way to view burnout, which I actually think is the wrong way, is that it's a final destination. Like you burn out, that's it, and then you move on to something else. I think it's much better to view it as a bump in the road. It is a temporary obstacle that you can overcome. And the solution may vary from person to person. Maybe you just need to take some time off, go on a vacation, or maybe even just the realization that you are burning out is enough to reframe your mindset. But just know that it's okay to burn out and you can get back on track. This blends nicely into my last point, which is take care of yourself. If you've watched any of my other videos, you know that I place a high value on sleep, exercise, and diet. These 3 pillars serve as a foundation for health, happiness, and success in all other facets of life. If these things are off track, setting them straight will improve your life in ways that you can't even fathom. Thanks for watching. If you enjoyed this video, give it a like, comment down below, and subscribe to the channel. I'll see you in the next one.